Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Today on the show, we have Erkeda DeRouen. She is a family physician. Erkeda, welcome to the show.
Thank you so much for having me.
We'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
Sure. So as you mentioned, I'm board certified in family medicine, also certified in lifestyle medicine. I'm originally from the DC area and currently live there now. I'm currently working as an associate medical director for a telehealth organization called 98.6. And I just love empowering women in tech as well as mentoring medical students. I also host a podcast, but it's more geared towards medical students and talks about the admissions process and hot topics in medicine called The Prospective Doctor, and also engage in a little public speaking. So I'm super excited to be here.
Excellent. And over the past year, it's been tremendously difficult for medical students. Obviously, they have to take a lot of virtual classes. They're taken away from their clinical rotations. Now, through your podcast and through your work with medical students, what do you feel are some of their biggest challenges, and what kind of advice and tips do you give to them?
I think a lot of their biggest challenges are that we're living in uncharted territory where they're not able to do their audition rotations or have the camaraderie of studying with their cohorts and things like we've had before. So they're having to kind of figure out ways, like through my podcast and other ones, of figuring out the admissions process. And it's kind of a rolling basis where we're having different program directors and different people come and talk about the new world, as well as figuring out ways to innovate things. So students have started to do virtual shadowing and things like that. So it's very interesting when people are under certain constraints and things, how innovation comes about.
Wonderful. So let's go ahead and talk about your KevinMD article. It's titled, "A Letter to Black America for Those Who Do Not Want to Take the COVID-19 Vaccine." Now, for those who didn't read the article, can you just walk my audience through it and share the story of why you decided to write it?
COVID-19 has impacted each and every one of our lives to at least some extent. So I was feeling quite excited when the Moderna and the Pfizer vaccines were released, but I noticed some apprehension on social media and other conversations just in the Black community about them not wanting to take it ever, if at all. So I was inspired to write the article actually after participating in an extended family group chat where there were quite a few people just saying how much they distrusted the vaccine and how they didn't want to take it. So I felt like there needed to be some more education out there, and realized that, of course, there is some normal apprehension just given America's historical relationship with people of color in medicine, but we need to think through things in a systematic manner and think about the scientific process. So I just wanted to start this necessary discussion, not only with patients, but also amongst our providers who may be caring for Black patients, and just let them acknowledge the distrust and figure out mechanisms in order to educate and meet patients where they are and support them.
Now, tell me some of the reasons why Black patients are hesitant to take the COVID-19 vaccine.
From what I've been reading and hearing about and having in discussions, a lot of it is because it feels rushed. Like it's called Operation Warp Speed, and they feel like there isn't enough information out there. Some people feel like they may be experimented on because some of the earlier conversations talked about how they wanted to try to get the vaccine out to the minority populations first instead of the traditional everybody's population. And things have changed now with the different tiers, but it to them it feels like it may be more experimentation.
So when they say something like that, and or if they say something like that to you in the exam room, what is your response, and what are some tips that you could share to help overcome some of those fears?
I think that firstly, acknowledging the apprehension is one thing that you can do, and kind of not putting a blanket assumption on why people may not want to take the vaccine. Meeting patients where they are and asking why. It may be because they are having similar thoughts as to what we just discussed, but it may be because they're afraid of needles or they had a reaction to the flu vaccine or something. So seeing why there's apprehension. But if it's more in line with what we discussed, thinking about how to talk to patients in a way where, yes, it does seem rapid, but SARS and COVID and things like that are not new. So this has been things that have been brewing and being researched for over a decade. It's just sometimes when there's more attention and more finances put into something, things move a little more quickly. Also talking about like the evidence and the data, how it has been studied at this point in time. It's been over a year for this particular two vaccines. So there is not longitudinal data, but there is some data that people aren't having severe side effects where they are passing away from taking the vaccine, and a lot of people are protected and it's not giving them severe disease. So doing all of the education and then also just giving them space to think about it, especially when you're engaging with the patient. They don't have to make the decision right now. You can give them the information and maybe check in with them in the next month or check in with them on your next visit to see where they are, and don't give up on them, because as more data comes in, you can give them more education.
I understand there's some historical context in terms of the apprehension Black patients may have against vaccine. Has that ever come up in your discussions with Black patients when you talk about the vaccine?
Absolutely. I think that the most famous is the Tuskegee studies and reports where things are going like that. Especially in my area, there's the long history with Johns Hopkins and all of the things that they had did with Henrietta Lacks. So there's a lot of information out there and a lot of things that are passed through historically. But even now, as we look in 2020 in the news, there are a lot of healthcare disparities. Black people are dying, I think, 2.8 times more than the general population from COVID in itself. And there are other things where Black women are dying in childbirth and things. So there is some valid distrust there, but just figuring out how to educate patients and support them and figure out how to not let them kind of block themselves off from the things that are available to them just because they are afraid. A lot of it's due to fear and mistrust is underlying. So how to figure out how to build that trust is important, especially as a partner, as their healthcare provider, where you are involved with some of their most intimate choices.
Now, can you comment on the role of social media? I know that there's a lot of misinformation on social media, specifically on Facebook. I'm seeing a lot of patients who come to me saying that they read this on Facebook. Is it true? Now, when you talk to patients, tell me that your experiences in terms of the information they're getting on social media, and what are some ways that you can combat that?
I think social media in this age is really important. I think when we were in training, things were a little newer and we wouldn't necessarily encourage our patients to look on apps or even have our physicians engage or have social media channels. But right now it's kind of a must-have, because we think of education in the traditional route, I guess, in the medical community, where you give them an after visit summary or you tell them to go and look at a journal or something like that. But patients aren't looking there. Their everyday lives are kind of incorporated on social media. So the things like Instagram, the things like YouTube, the things like TikTok and stuff like that. So that is what our patients are using. So we need to figure out how to spread information that is accurate and easy to digest, because if we don't, as we've seen, like there are communities out there who are discussing things and they may not be as accurate. So we need people with the certain educational background and knowledge to kind of counter that and spread the message in ways that it'll actually get to the patients and they'll actually look at it. So there is a lot of engagement with different healthcare providers who are getting on those platforms and educating, and then it's spreading things, and it brings your patients and they'll say, oh, I saw this thing on Instagram. Is that true? Where you can show an easy diagram or a quick YouTube video, and it's helping them learn in different modalities.
We're speaking with Erkeda DeRouen. She is a family physician, and she wrote the KevinMD article, A Letter to Black America for Those Who Do Not Want to Take the COVID-19 Vaccine. Erkeda, the vaccines have been out for 3 to 4 months now, and we've had time to do plenty of messaging, both in mainstream media and through what you're doing in the exam room. Do you think the needle has moved since the introduction of the vaccines? Do you find that more of your patients are more accepting of the vaccines?
Yes. I can definitely see from when the vaccines came out in about December, and even when I wrote this article, there is a lot of engagement and people wanting to learn more. I think that with the different rollouts, we're seeing that there are waiting lists and people just waiting to see and get the vaccine. Of course, there are still people who are still unsure.
Mm-hmm.
And I think now we'll have to continue those conversations, especially as new vaccines come out and evolve who may work a little differently. So we have our work cut out for us, but I think that as long as we continue to engage and educate and inform, more people will get on board, especially as time goes on.
And my final question, what's your take-home message that you want to leave with the KevinMD audience?
My take-home message is that being a part of the medical community comes with great responsibility. So we have to educate our patients and our community, especially about the pandemic, as there's a lot of conflicting information out there.
Mm-hmm.
So also figuring out ways to mentor those who come after you, as those will be the future leaders of healthcare, and that it's okay, especially with me being in technology and kind of a non-traditional medical pathway, to kind of create the life you want. It's okay to pivot into someone else. And I guess for those who are listening, like, I just want to appreciate you for taking the time to listen. If you haven't checked out my article, definitely go on the KevinMD website and blog and look at it. And feel free to reach out to me at drerkeda.com, DRERKEDA.com, if you want to chat more about this or any other opportunities in the future.
Well, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you so much for having me.